a heck of a long way from where you were when this all began. I want to play people video from day 4 of this for you. This is, I believe, you were in the hospital and could barely breathe. So let's watch.
The video's in the bathroom.
Okay, bathroom.
It feels like I can't breathe. The deeper the breath is I take, the more it actually hurts.
Oh man, I gotta say that's horrifying. You can see the struggle to breathe there. You wrote it was like being underwater.
Yeah, that's the analogy I keep giving to people, that it felt like I'd been underwater too long and I came up gasping for air. And just when I thought I was catching my breath again, I got pulled underwater. And what you just saw there, that was happening, maybe once an hour, every couple hours. And it kept coming and going. And that's why I kept telling myself, okay, I'm getting better. Sometimes I might go a few hours without it happening. And then over the course of day 5 and 6, started happening more and more until it was just like that all the time. And the night before I went to the hospital, I was basically like that all night. Never slept because I couldn't fall asleep. And I was afraid if I did fall asleep, I was worried I might stop breathing. I made up my mind probably at about 3 or 4 in the morning, I need to be in the hospital, and called 911. It was probably about 7 a.m. by the time we called 911.
Can we play that again? I just want to play that again so people can see how hard it was for you. Impossible, in fact, to get a full breath. So let's play that again.
It feels like I can't breathe. The deeper the breath is I take, the more it actually hurts.
One of the most chilling things you wrote, Jason, was you wrote, if you were asked the question, are you confident that you will live through this? You couldn't give an honest answer.
Yeah, I sat in the hospital room, and you're there by yourself. It is a very lonely experience. The nurses and doctors really limited their time in the room. And I got out of bed at one point. I was on day 2 when I was strong enough to get out of bed. And I stared out the window for a while and kind of had a little conversation with myself. Are you going to make it out of here? And I said, I think so, but I'm also watching the TV in the hospital and seeing all these stories about people who were totally healthy, and the next day they're in the hospital, and the next day they're dead. And I'm saying, who knows? I could take a bad turn an hour from now. You never know. And that was kind of a gut check moment. It really hit you.
We can hear you, by the way. The breaths aren't 100% free. I mean, I can still hear the breath being something you have to work on a little bit right there. Ultimately, you didn't need to be intubated, but you did get oxygen. What got you better?
The oxygen, and they also gave me a drug called Levaquin, which they said they were hoping, I had pneumonia, both upper and lower lungs, both sides. So they gave me Levaquin to try to help fight the pneumonia, and the oxygen. So I was terrified walking out of my house. The EMTs asked if I was able to get to the ambulance on my own, so they didn't have to come in our house, which was full of germs at this point. And I told them yes. I got halfway down the stairs and had to take a break. Finally got out to the ambulance, and they put oxygen up my nose right away. And the ambulance ride was actually relaxing because I could breathe for the first time in days.
Jin Kim tested positive for coronavirus 3 weeks ago after returning from the United States. He's been in hospital ever since. One negative test this week gave him hope he had recovered, but the next day he tested positive again. A patient needs 2 negatives in a row to be considered recovered, but Kim says even after he's discharged, he will self-isolate for 2 weeks to protect his family.
If my virus activates again, I need to go hospital again, and at the time my family should do self-isolation again.
It's a concern around the world, cases of testing positive after appearing to have recovered from the virus. Deputy Director of Korea's CDC says there are 4 possible explanations.
First of all, just a weakened immunity, and second is found just the remnants of viral particle and the possible test error. Also, the finally reactivation of the very low undetectable level of viral particle.
Kwon says tests on a family of 3 who retested positive have already been completed, and there is no evidence of the live virus still in their bodies. He believes remnants of the dead virus is the most likely explanation at this point. He also says there's no indication recovered patients are contagious when they retest positive.
Until now, there is no danger of further secondary or tertiary transmission.
Kwon hopes to know more in about 2 weeks once tests have finished on well over 100 other cases where people have recovered then tested positive. Half of them, he says, had no symptoms. For Kim, it's just a case of waiting.
How are you feeling at the moment?
Actually, after I got test positive of COVID-19, I was frustrated, but now I'm feeling better.
Paula Hancock's CNN Seoul.
This was painful.
Amy Driscoll says coronavirus had her in a vice grip that wouldn't let go for weeks.
Every breath, every movement, every, raising your arms, rolling over in bed, every single thing is painful.
Less than 2 hours after arriving home from the hospital, her phone rang. It was the county health department asking lots of questions.
Who have I seen in the last 2 weeks? Where was I in the last 2 weeks? Who was I in contact with? Where do I work?
The health department was doing what is called contact tracing.
You have to trace every person who comes up positive.
Driscoll traced her steps. She'd gone to work. Her boss and staff had to be contacted. She went to a restaurant for lunch. She went to her hair salon. They had to be contacted. She went to a Cleveland Cavaliers game. All her family members who sat with her were contacted. This kind of contact tracing is happening across the country and the world.
Respiratory for the 8th floor.
From those suffering through the deadly COVID-19 outbreak in New York to those connected to the first major U.S. outbreak in Washington state, to California, the first place where a statewide stay-at-home order was announced. Experts say without contact tracing and enough testing, America and the world cannot reopen safely.
We're going to be at risk of resurgence of this disease, not just in the fall, but going into next year.
So you're saying without contact tracing, a massive amount, without testing, a massive amount, we could find ourselves right back where we started.
I think we could find ourselves very much at risk of another resurgence.
But the U.S. does not have enough people to do the tracing. State health officials estimate there are about 2,000 people doing this work now. But Johns Hopkins University warns we need at least 100,000. For now, contact tracing is only as good as your memory. This is hard. I mean, before stay-at-home orders, can you remember all the people you had close contact with over a 2-week period, say, at the coffee shop? Or at the grocery store? Or at a restaurant? Or at your child's school? And that's where big tech like Google and Apple are jumping in. They will soon have an app you can voluntarily download built with health departments so they can see detailed location data from your cell phone. But the public may be skittish about it due to privacy concerns. Still, contact tracing requires serious legwork. LA's mayor is pushing for federal help.
We're probably going to need hundreds of thousands of Americans to be put to work. It should be funded by the feds, but enacted locally.
As for Driscoll, her contacts have been found. The health department tells her that none have symptoms so far. But testing is still a problem.
I've had no additional testing.